woman should know how much blood is entirely normal to lose after birth, regardless of which birth mode you are having. Now, this is worth a watch and a save. And for more pregnancy, birth and postnatal information, tap the follow me button. Now, the human body in pregnancy is incredibly clever. It actually accumulates about an extra 500 mils of circulating blood volume because it knows that you are going to lose blood after your placenta is delivered. So what your body does in pregnancy, it gives you extra blood volume that obviously increases your blood pressure throughout pregnancy. It causes hemodilution, which can cause iron anemia. And actually, if you have a look at my previous videos, you'll understand why in the third trimester you feel so tired because of this impact. So the normal blood loss to lose after birth is about 500 mils, which is about 5 pads worth in total. It doesn't seem like a huge amount when it's actually here, but actually 500 mils looks like quite a lot when you're on a bed and you've just delivered your baby. But it is about 5 postnatal pads worth in total. And of course, the volume of the blood after birth can make it look like a lot as well, where actually it's a lot faster flow. And it can also come out in little clots, like this, for example. So small little clots. Anything that's more than 500 mils is classed as a postpartum haemorrhage here in the UK. Now, women who have a physiological third stage, so that's where they don't have the injection for the placenta, can lose a little bit more blood than this. And sometimes the thinking is that it can be up to 750 mils without the injection for the placenta. Now, any woman who has more than a 500 ml blood loss is usually recommended to have the injection for the placenta to reduce the amount of bleeding that a woman has. So postpartum haemorrhage, we average it as anything over 500 mils. Now, as for the symptoms, this depends usually on your BMI, so how big you are, how well you cope with blood loss, and also your iron levels as to how symptomatic you can become. So someone who is of smaller build, for example, will more likely become a lot more symptomatic of the postpartum haemorrhage at a much smaller blood volume than someone who, say, has a much higher BMI, who can compensate for longer. And part of that is to do with the amount of blood circulating volume that happens. How we estimate blood loss as midwives is we weigh pads, we weigh Inco sheets now. It's a far more accurate way of actually measuring postpartum haemorrhage. So the most common sign and symptom of postpartum haemorrhage is excessive blood loss, actually being able to look and see how much blood there is. And that's why we often measure now as midwives, as if we think that you are having a postpartum haemorrhage, there's loads of blood coming out, then what we tend to do is weigh quicker, but also we're managing that postpartum haemorrhage really quickly, which I'll go through in another video. Now, other signs and symptoms of postpartum haemorrhage include you feeling really unwell, really sick, really shivery, really nauseated. Usually your blood pressure goes down, your heart rate goes up because it's trying to work harder to be able to actually keep your blood volume there. And also abdominal pain can happen for some women as well with a postpartum haemorrhage. For really severe postpartum hemorrhages, where actually there's a lot more fluid and a lot more volume, actually feeling like you're going into shock. So suddenly feeling cold, for example, can happen. Suddenly feeling like you're going to pass out. Faintness is also signs and symptoms of really severe blood loss. And this is why, as midwives, what we do is we do skills and drills training, and we have lots of things that we can do to manage and prevent and actually intervene with postpartum haemorrhage if we diagnose it.